There are a lot of marriage and family issues. Oftentimes, people don't really, everybody focuses on the patient, and yes, you should focus on the patient, but the patient has a spouse oftentimes or a significant other, and they're going through an emotionally charged, they love this person, and it's heavy duty. It's heavy duty for all concerned. It's not just the patient alone. I think it's important for women and men to discuss intimate needs. Good communication is important. There are different styles of relationships. No matter what their kind of relationship is, I think communication is a key. And communication in terms of sexuality, as well as communication in terms of anything else, it's where it's at. And the partner, one of the things you discover is your partner is much more accepting of you than you are, and that's from all these years. That's what I've discovered, and I've seen women just get so upset, and they obsess on this to the exclusion of all kinds of other thoughts. And the truth of the matter is, once they get back into sex, it just doesn't seem to matter. Initially, the first time, it may be say they've had a surgery or something like that. It could really be like walking on thin ice or eggshells and stuff like that. But once you're back in whatever for a particular couple is normal for them, they're all set. That's ridiculous to equate breasts with femininity. The truth of the matter is, you are a human being, a person, and in your own right, it just flows from you in terms of being a wife, being a mother. You know, it's just marvelous, and it has very little to do with one small part of your anatomy. It's a total you. One of the things I've discovered, and I've worked with, I mean, I've been at this 31 years, so you can imagine how many couples I've seen. Almost never does the guy get upset. He loves his wife, and he wants her any way he could get her, and it doesn't bother him. I think it's important for the caregiver to share what their sexual needs are. So often, I use the expression of walking on eggshells. They're afraid of hurting or asking somebody that they feel is going through this terrible experience. They're putting an extra demand on them and asking them for something that they may not want to give or be unable to give. And if you have good communication, you talk this out. And one of the things you discover in short order when you begin to talk things out is everything gets worked out. And all these frightening things and all this stuff, it just doesn't have to be. But if you keep quiet and you don't talk about it, they could take on a life of their own and become a whole thing. And there's no need for that. And it's so important to share and to talk.